Hi, my name is Raj Balasubramanium. My poster is Characterizing Patient Mobility. My lab under Lauren Myers, we look at contact networks and how disease spread. As part of that, they were looking at workforce data to kind of approximate some of the patient movement. As part of this project, we had the fortune to actually take the Texas hospital discharge data of a patient coming from a zip, going to a zip in a hospital, and we're able to use that to build a model, and this poster is pretty much a summary of that. So the first thing we did was we visualized Texas as the 254 counties that it has as an underlying network, and we used that network to approximate a lot of other properties of the patient movement itself. So from there, we have two derived networks that we get. Two directed. One is the workforce mobility that based on people traveling for work from the census tract data, and the other one is the hospital discharge data itself. Right. So in this case, we're treating the network as a directed unweighted network. So the next project I'm looking at is as a weighted network. So if there is any patient going from county A to county B, there is an edge there. Right. So that same thing applies with workforce as well. So the two things that we wanted to do was look at network properties, and we were not really interested in propagation, but more so of travel itself. We looked at two of them. One was the degree distribution, in this case both in degree and out degree, and the second was the clustering coefficient. And since it's a directed network, the clustering coefficient is more of a four-tuple as opposed to just a single number. And so you have these different signature components, so to speak, the cycle, the out, middleman, and in, which kind of signifies that network, that directed network clustering coefficient. And that work came from Arnott, that had done some work on it in the physics and economics community, and we kind of borrowed that and we compared that to some of the networks that he had done as part of that paper. So those are two things, and what we observed for the workforce and the patient network was what we anticipated, is they were different in that even though the out degree was similar and homogeneous for both, the in degree for the patient was actually following a power law, whereas the in degree for the workforce was homogeneous following the negative binomial. That was one piece. The other piece was the clustering signatures was actually a little different. Where for the patient network, there was a marked peak of the out component as opposed to the cycle, middleman, and the in component, whereas for the patient, so the workforce network, it was all the same. So the next thing we wanted to do was we wanted to see if we can create a simple model and not create something complicated, specifically because the patient, there could be preferences, there could be hospitals, so on and so forth, a lot of different factors going, but we wanted to kind of simplify that. And we took an approach of a gravity model, where we actually had the population of the incoming county, or the source county and the destination county, and we actually used the network distance. And we created the logistic regression model based on this gravity model, and we were able to simulate networks by randomly assigning populations to the underlying county and the county distribution itself, and then creating the network for workforce or patient, and then measuring the properties. And so this kind of gives a summary of what we've done, and the simulation model actually approximates very nicely, and providing us both the properties of degree distribution that we want, of power law and the negative binomial, as well as the clustering signatures that we have here. So this is actually a multidimensional scaling plot, which is more so of the distance between each one of the directed network, to show you that it is actually in fact closer as we observe it. You see that here, but also it's more clearly shown that the simulation actually worked, right? So the next future work that we're looking at is adding the weights, the patients, to the edges itself. So now we can actually predict the number of patients going in using a similar model that we were working on, and then state of Texas is extremely interested in looking at this to do things like, if there is next Hurricane Katrina, how does Houston get affected, and Austin, and so on and so forth.